the first slide, that's what our ancestors had looked. And face is that has 46 muscles, 46 muscles of expression, and your day-to-day activities, you look into your mirror, and nowadays the phone is there. So wherever you go, you see some men, some boys, some girls, some small girls, they look and they admire themselves. And also, the face is it is a subject of its own. I have 2 volumes of books, How to Read Faces. Some astrologers and all, they are practicing how to read faces. It's interesting, but I have not explored all the chapters, but I have gone through it. Another thing, see, what I want to say is that if 2 ladies come to your chamber, a mother and also the daughter, you quick see the 2 faces, and you go and the daughter is your patient, you ask, and sometimes you look into the mother's face, and ultimately when you are seeing the patient and when you call the mother inside, you see her face again. And, hey, tomar mein na eta, this is your daughter? Ha, doctor. Now, what happens? The mother thinks and the daughter thinks also that how could the doctor know that I am her daughter or I am her mother. So this is a extra advantage in your clinical practice, but you have to quick see faces. Now, other thing, your expressions, your love expression, your emotions, your fright, your sadness is all expressed in the face. Also, your tiredness and you are ill. See, this girl was ill that day. She was running a temperature, but she slept all along. I didn't disturb her. So, it is, this is the face. Now, introduction. The forehead is common to both the face and the scalp. Now, you see the total outline. Skin of the the skin of the face, very vascular, rich in sweat and sebaceous glands. Skin is lax on greater part of except the nose and auricle. Receive the insertion of facial muscles. Contains superficial fascia, facial muscles, vessels, and nerves and fat. Deep fascia is absent because you have to be knowing the anatomy of the face. See, a road traffic accident or something, you fall, the face is injured, cut, or during a fight, there is the face is mutilated. Moreover, the acid throwing is a common event. If a girl doesn't want to date that boy, Suddenly, all of a sudden, someday he puts a splash of acid. Now you know the face, the disfiguration of the face. That lies in the anatomy. So, whenever you are suturing, you have to be very careful. You are an artist. A doctor is a surgeon is an artist. You have to see how and what type of sutures you have to use. You have to use 40, 40, 30 according and small needle to at least decrease the mutilation and also see its divide of deep fascia. If it had deep fascia, then what it would like? But it is smooth. Now, at this age, I am loving myself. I spent some time doing exercise and putting some facial cream or something like that. But the age, you cannot defy the age. The skin all becomes loose, lax as you age. But at this age, please don't at least spend some time to you love yourself for half an hour. I tell the boys, I'm telling you the girls. At least you take care of yourself. Self-care. You need not go to the parlor or something like that. Now, now these are the vasculature of the auricle, parotid gland. This is the parotid gland, the auricle. See, if anyone gets a burn or some infection, the pericarditis, the cartilage, then you have to take very much care and handle it. Another thing is that is the auricle is concerned. Now, some people, I would say, because I want to wear a diamond ring. I pierce my ear, but suddenly it swells up and all, and then again subsides. Then it becomes a keloid. You don't know the keloid is a genetic disposition. So, even you go to the parlor and do multiple pricks to put some earrings, small to big, a diamond. And so, the masseter muscles, the facial vessels, the buccinator muscles, these are now we are entering the head neck. Naturally, these all will be shown to you in your dissections. Muscles of facial expression. See the different types. 46 muscles are there in the face. Okay. Now, muscles at the orbit. Now, Orbicularis Oculi, orbital, palpebral, depressor superficially, corrugator supercilii, occipital frontalis, levator palpebral superioris. This when you go in head neck region, face, these muscles, and especially the skull bones. Now, now these are the muscles. Orbicularis oculi, the orbital part, medial palpebral ligament adjoining frontal and maxilla. So it will be just knowing, you just know the names today. And when you study the bones of the skull, then you correlate it. Now, the action acts as a sphincter, eyelids and palpebral part closes the eyelid gently. The contraction of the entire muscle produces radiating skin folds from lateral angle of the eyelid, so called crow's feet. Lacrimal part draws lacrimal papillae medially and dilates the lacrimal sac, thus help in transport of tears. Paralysis of muscle produces drooping of eyelids, ectropion and epiphoria. Now you see muscles attached to the nose, the nasalis, procedus, depressor septi. Okay. The muscles of the lips and cheeks, orbicularis oris, sphincter muscles of the mouth, elevators of the upper lip, zygomatis minor, levator labia superioris, levator labia superioris nasal, levator anguli oris, and zygomaticus major. The depressor levi of inferiors, platysma, depressor angularis and mentalis. This is the platysma muscle. See, wide band from the clavicle, below the clavicle it goes. Sit in front of the mirror, you can just see the whole, it's not visible like that, but when you dissect, you will see the layers like this. It comes like this. Now, retractors of the angle of the mouth. Zygomatis major, depressor anguli oris, risorius and platysma. You see all these things, you go the muscle. You make faces, Okay. And you, even when you are standing in the front of the mirror, being a doctor, you know the muscles of facial expression, so you just exercise all different faces. And you want to show someone some face, then you practice before showing him. রাগ দেখাবে আপনি দেখবে ঠিক রাগটা হচ্ছে কিনা. Okay. Muscles of the cheek, the Buccinator muscle, the origin from the surface of the maxilla and mandible opposite the molar teeth from pterygomandibular ligament. You have to know the skull bones, facial bones, nasal bones. When you read, at least just know the names now. More like when you individually learn the mandible, you are individually learning the temporal, your maxilla and the nasal bones. Then you go into the detail. See, it's covered outside by buccopharyngeal fascia and buccal pad of fat. Its surface is lined by buccal mucosa. It is pierced by parotid duct opposite this upper second molar tooth, and the buccal branch of mandibular nerve is supplies to mm cheek on the inner surface of the Buccinator muscles. Emotional expression. Now, emotional expression: frowning, anger, sadness, laughing. Now, these are the individual muscles which come into the frowning, anger, and naktak furium. like Ravan. Okay. Or you become sometime Ravan or some, well, they can, okay. And your sadness, laughing, see this old lady, these are the lines, funny lines, brows droop, forehead lines, frowning lines, they become deeper. See, I see my face sometimes and I see all this and the wrinkles that is happening. But previously I had long hair, and as I used to do photography, there was no selfie, but many types of photographs I have of myself. And now this is another picture showing the different muscles, the occipitals, these muscles. Arterial supply of the face, superficial temporal artery and facial artery, superior orbital artery, supratrochlear artery and infraorbital artery, buccal artery, and this is the mental artery. Now, when a person comes with a cut or a hit in the scalp, on the skull, then you just know the location of the arteries. It's very simple. Scalp bleeding is profuse. That's why you see in TV, when some political, they are having fight, then they come and say, jol ঢালছে, water, দেখুন 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 কিরকম মেরেছে, হ্যাঁ এরকম মেরেছে. But once you take your, see, if any one of you fall, not only you get a lathi charge or something like that, but you take your this chunni and make it tight. And then nowadays, everyone is, culture of UP and Bihar has come into Bengal wearing a uttariyo. Uttariyo means this gamcha. And you can use it. If you are traveling, you just take that gamcha and tight. The bleeding stops. Now transport to the hospital. Now when you are seeing that it is tied up, bleeding, blood clots, you make all your instruments ready, needle holder and all to give stitches, and 2% xylocaine injection, some distilled water, and then you infiltrate the portions where it is injured. And you ask your assistant to just hold the one hand, he holds it like this and presses them there. So the section, small hemostatic forceps, you clamp. Some major vessels, superficial temporal artery, these portions. In any condition, it would be medical case or a surgical case, and see, A person at midnight came to the emergency when I was the house staff with a tangi, the small, short, they cut trees and plants and also nariyal. Okay. He came with a deep cut up to muscular layer like this. What I did is this. I cleaned the portion, infiltrated these procedures, I'm telling you, can be managed with 2% local xylocaine. Don't go for looking for anesthesia, anesthetist and all the mid of the night. You can manage it invariably under local anesthesia. Now I sutured, layer by layer I sutured. Okay. And then I gave next morning, around 10 a.m. I was in the rounds, I gave him a cervical collar. So it doesn't go like this. So it is at rest. Now, this is one thing, the posterior aspect, anterior aspect I told you, and the master muscles again I've shown here. The facial vein branches, lateral nasal, superior labial artery, inferior labial artery and facial artery. Superficial temporal artery, these can come as a small note, facial vein, facial artery. And when you hold the skull in practicals, what's the arterial supply of the anterior of the skull? Orbit, supraorbit, supraorbital, trochlear, supratrochlear, like this. Temporal, see, you just feel it here. Sometimes an aged person around 70 years comes to you, you lie him on the table for just a blood pressure checkup or you're a general practitioner in your mahalla. Then you see the blood pressure, but you can see the pulsation of the temporal artery. It's visible. You can feel it. You can feel your own temporal artery pulsation. This transverse facial artery, the parotid duct, the superficial temporal artery, the supraorbital frontal, the facial artery, the pulsation sites, like you can feel the facial artery pulsation, and also the superficial artery. The venous drainage of the face, the supratrochlear vein and supraorbital vein, this is the supraophthalmic vein, the angular vein, deep facial vein and drains into the facial vein. Now this is jugular artery, angular artery, lateral nasal branch and supralabial artery and infralabial artery. Now supratrochlear vein supraorbital vein, facial vein, the deep facial vein, facial vein. This is the repetition of the same picture. Now facial veins, see, that can be a short note on facial veins. Superficial temporal vein, maxillary vein, retromandibular vein, internal jugular vein, posterior vein, external jugular vein. Now in OSFI, you get a label, they can label a supratemporal vein and supratemporal artery. OSFI. Okay. Maxillary vein, superficial temporal vein, retromandibular vein, it drains into posterior division, posterior auricular vein, anterior division, facial vein, and common facial vein, external jugular vein. You can take a snap of this. Internal jugular vein. Now, see supraorbital vein, supraorbital veins to superior ophthalmic vein into cavernous sinus. These are the emissary veins. Now, facial vein, deep facial vein, pterygoid venous plexus. When you read the skull, then you will come across these words: the cavernous sinus, the pterygoid venous plexus, and they are all draining into these are the emissary veins into the cavernous sinus, pterygoid venous plexus. Now the cavernous sinus, you see, the pterygoid venous plexus, superior ophthalmic vein, this is the eyeball, and this is the facial vein. Now facial vein, the deep facial vein, superior ophthalmic vein, cavernous sinus, emissary vein, pterygoid venous plexus. Now, dangerous area of face. This is important. See, some people, they have a pimple here. You suddenly you press or you mutilate. Don't. Then this, because see, the facial vein is devoid of valves and rests directly on the facial muscles. Rests directly on the facial muscles. The movement of the facial muscles might facilitate the spread of septic emboli. This is septic emboli. Infected area of the upper lip and lower part of the nose is retrograde direction. Causes thrombosis of the cavernous sinus with serious complications. Hence, the upper lip and the adjoining nose lying between the angular and deep facial vein from the dangerous area of face. This can be a short note on it. It is every chance you get a short note. Even when you are giving your viva, the skull and the other things, then if you are answering very well, then the examiner will ask you what is the dangerous area of the face. Okay, these. Now lymphatic drainage. The parotid lymph node. This is the parotid lymph node. Superior jugular middle deep jugular, inferior deep jugular. This is supraclavicular lymph node, the submandibular lymph node, submental lymph node, and the facial. Sometimes what happens, the glands lymphadenopathy, cervical lymphadenopathy, due to any infective cause, there will be lymph node swelling. Okay. Lymph drainage of the face. Lateral part of the face, parotid lymph nodes. Medial part of the face, submandibular lymph nodes. Central part of the lower lip, chin and submental lymph nodes. So, lateral part is the parotid lymph node. The medial part of the face is submandibular lymph node. These submandibular nodes I showed you in the previous picture. And the central part of the lower lip, chin and into the submental lymph nodes. Here, submental. You see the glands are swollen up. That's why when you are examining a patient with some sore throat or some infection in the scalp or in the face, you please wear your gloves and you palpate. But if there is no pus point or anything, you can just palpate with your open hands. It doesn't matter. Okay. Now, nerve supply of the face, sensory motor. The motor facial nerve except masseter. Sensory trigeminal nerve except the area of the skin at the angle of the mandible. So, you know the nerve supply of the face, sensory trigeminal nerve except the area of the skin at the angle of the mandible. Motor facial nerve except masseter. Now, facial nerve, see the facial nerve. Like this. When you read the facial nerve, this is a hand like this, the branches. Now, see the temporal, buccal, marginal, cervical. See, this is the facial, the temporofacial branch. Temporal, zygomatic, buccal, mandibular, cervical. Easy to retain in your head. What are the branches of your facial nerves? Now, this is the easiest way to remember. আবার হাত দিয়ে বেশি আদর করে দিস না, বোঝা গেল? দেখি দেখি তোমার টেম্পোরাল নার্ভটা, দেখি দেখি তোমার বাক্সাটার নার্ভটা। You have to be careful. Now, trigeminal nerve, the great auricular nerve, ophthalmic nerve, maxillary nerve, mandibular nerve. Now, this can be a short question, trigeminal nerve. Now, see the mandibular nerve, ophthalmic, sensory, maxillary, sensory, mandibular, V3, sensory and motor. Now, the ophthalmic branch, maxillary branch, semicircular ganglion, this is semicircular ganglion, and the mandibular branch. This is a similar picture. supraorbital, supratrochlear, lacrimal, infratrochlear, external nasal, infraorbital, zygomatic-facial, buccal, mental, auriculotemporal, now supraorbital, infraorbital lobe, and mental lobe here. Ophthalmic nerve, the supraorbital, supratrochlear nerve, forehead and upper eyelid. The lacrimal nerve, lateral part of the eyelid, infratrochlear nerve, lower eyelid. External nasal, nose till the tip. Maxillary nerve, infraorbital, palpebral and nasal and labial. Zygomatico-facial, skin over zygomatic bone. Zygomatico-temporal, skin of the temple. Mandibular nerve. Mental, lower lip and chin. Buccal, skin over buccinator. Auriculotemporal, skin over auricle and temple. This lady came to me, her face mutilated with burn contractures. Now, she was born as a child. Child means adolescent girl. She carried this burn and she's looking, her looks, but main thing, the eyes actually. What I did is that under local anesthesia, I released these contractions and I took skin from the thigh and postage stamp. Now, I sutured with fine silk. It took me around 2.5 hours. Under local anesthesia, I did how much I could do. And the daily dressing was done, not daily, alternate days. The dressing was done with honey. This is a gauze soaked in honey. And only I wanted a ophthalmic surgeon and a plastic surgeon to, but she had some problem. She went back home. After that, since that time, I don't know if how much could be corrected, the ectropion. So, because the muscles are lost, orbicularis, and see the contractions over here. I released it by Z-plasty, where some small incision, diversion of the skin, that was done, and removal of scar tissue, and the healing by honey gave this picture. Then she, when she was leaving, she told me, Dada, তোমার সাথে একটা ছবি তুলবো। আমি told. Then I was sitting in my chair. She's feeling comfortable. এই জায়গাটায় তোমাদের বলতে চাইছি, এখন ডাক্তার বাবুরা কথা বলে না, যে যত কম কথা বলে সে তত বড় ডাক্তার। কিছু জায়গায় ভগবান, ডাক্তারবাবু আপনি ভগবান, ঠিক আছে, তো সেই ভগবানের জায়গায় সে যখন চলে যাচ্ছে, when they reach the altar of the God, they think something great. they feel something great. I won't teach you anything, but I teach you my life that I am encountering day to day. And this is the happiness I have in myself. So please be a human being. একটা ছোট হলে মোটা দিয়ে সেলাই করে দিল বা ড্রেসার বয় আছে তাহলে সেলাই করে দেও। You sit down, you do it yourself. একটা উটিতে ড্রেসার বয় করে দিল, he might be a very good dresser, he might be a very good assistant, but he is not greater than you or better than you. Okay? Now, at least to some extent, I won't take the credit. It is no, but where will I get my skin? From back flap, over this flap, there's no muscle. Or skin, I would say skin, not muscle to be transposed. It's not that. It is the skin that has to be sent. This is the condition of India. The rural people, even Calcutta, Park Circus, Jadavpur are villages. Anyone there to counter me? What is the fate of a lady in the hills of Jharkhand, hills of Himachal Pradesh? Is the same fate in midnight in Calcutta, Delhi. So you become a very good MBBS. Your life will be fulfilled. Of course, you are having a scope. You do webinars and all this, but not at this stage. You do it after your internship. Prepare for NET, PG. There are lots of seats going vacant. Do a degree, acquire these certificates and all, but you don't acquire fake degrees. You go do a DNB or in any subject. But UK, Australia, no one bothers. No one asks me till date, Dr. Babu, আপনার ডিগ্রিটা কি?